I'm really glad to see you all here today. Just as Donna gets up the presentation, I'm going to maybe start by highlighting two key things about this. The first is that it builds on previous legislation. So in terms of the Care Reform Act and the right to breaks from caring, it builds particularly on the Carers Scotland Act, which came into force in 2018, and also the Social Care Self-Directed Support Act, which I imagine all of you are very familiar with. So I just wanted to make that point because it's important to note that in terms of bringing in the right to breaks from caring, the systems and the processes are generally there already. It's more about expanding them and looking at capacity. But we'll go into that in a wee bit more detail, but I just thought I'd start with that. And then the second thing is, it's not law at the moment. There is a bit of kind of misunderstanding in some areas about that, but in terms of the right to breaks from caring and the Act itself, the Care Reform Act, although it has become an Act, it's received royal assent, it hasn't actually become law yet, and I'll explain a wee bit more of that in a minute. So I'm going to cover today, first of all, the duties in the Act relating to breaks from caring, and because it's a framework bill, and a framework bill basically means that most of the details will be brought forward in regulations, there's not a lot of detail. So in terms of the face of the Act, it's quite simple in the way it's laid out, the right to breaks from caring. I'll tell you about the additional amendments that came in stage 3, which you may not have heard of. I'll talk a bit about the routes to support, how carers will be able to access the right to breaks from caring, and the development of regulations, what's happening around that. I won't be able to give you timescales exactly, but I will be able to give you the stages that need to be gone through and what's happening at the moment. I'll talk a bit about provisional funding for this, which is basically what is set out in the financial memorandum. And I'm hoping we'll have time. We'll stop at that point for a few kind of discussion questions and to get your feedback. And then I'll go on if there's time to talk about the timescales for adult carer support plans and young carers statements. And I think at this point, although I've just said it's a framework bill and so a lot of the detail is coming later, I think it's always good to start these discussions early. It doesn't mean we have all the solutions at the moment. It doesn't mean I can answer all the questions you might have. But we can start to think about what needs to be put in place, what preparation we need before the right to breaks come in. Next slide, please. So I'm very briefly going to touch on why we have the right to breaks is coming in. I mean, in a nutshell, you'll all be familiar, I'm sure, with the Independent Review of Adult Social Care, the Feely report, as we often call it. And Feely spoke to many carers. In terms of the coalition, we spoke to about 1,000 carers, and we put that information in through the consultation. And Derek Feely also came to one of our meetings. And he made some really important points. I remember him saying in one of the meetings that, you know, as well as being an essential resource and the caring that carers provide, they're also human beings and they need a break. And I think that's so important to remember. So Feely recommended that carers should be viewed as integral, and it's recommended that carers need better, more consistent support to carry out their caring role. And he recommended that carers should have a right to a break, a right to respite. And the Scottish Government agreed with that, which is how it then came through the bill. But actually, that kind of discussion around whether carers should have a right goes far further back. It goes back at least 10 years. In 2016, the SNP had a manifesto commitment. It wasn't phrased as a right to breaks from caring. It was phrased about improving availability to short breaks and how they can be guaranteed. So really, more or less, a right to breaks. So it may seem that this has come about for some people out of the blue, but actually it's been about 10 years in the making. And it will be about 10 years by the time that original commitment in 2016 comes into force. The reasons why carers should have a break are pretty self-evident, but I think a few things to note. It's really important to note the fact that there's more care provided by unpaid carers than by the health and social care force combined. And it's so important to maintain their health and well-being, but it's also important that carers have a right to life alongside caring and that their human rights are respected. So for all those reasons, we believe certainly that the right to break is an important step. Next slide, please. So in terms then of what is set out in the Act around the right to breaks, what does it actually mean? So what's changed? So at the minute, in terms of the Carers Scotland Act, which is the act that's been amended to bring forward the right to breaks from caring, carers have a right to an adult care support plan or a young carer statement. But they have no right to a break within that. What the Carers Act says at the moment is that it should consider whether support should take the form of a break from caring. And at that point then, the local authorities have a duty to provide carers with that break where they meet local eligibility criteria. So when the right is enacted, that's when this will change, and the Carers Act has been updated to bring that into force. So what will happen then is that as part of the adult care support plan, you need to determine, or the young carer statement, you need to determine whether the carer can take sufficient breaks from their caring role, ensuring this is an identified personal outcome for every carer. So basically at the minute it needs to be part of the conversation, but when the Act is enforced, it's the sufficient breaks that's important. You need to determine, does the carer have sufficient breaks? So that definition is going to be important, and I'm going to come on to that in a minute. And that, again, as I said, needs to be an identified personal outcome for every carer. Where carers are unable to take sufficient breaks, this is an identified need, and that's where it becomes a duty. It may be that carers already have sufficient breaks. Some of them may be getting it already from statutory. They may have a care package. It may be that they're getting breaks because of the package going into the person they care for. It could also be that they're receiving support from family and friends, and that's sufficient for them. It could also be they're not receiving statutory services, but perhaps through brokerage or other community support or the third sector, they feel they're receiving sufficient breaks. But where it's identified they're not, then that's when it becomes an identified need. And that means this duty is not subject to local or national eligibility criteria, which is a big shift and something that needs to be taken into account. Next slide, please. So the definition of sufficient, this is where a lot of this hangs on. Now, this is a draft of the definition. It's been developed by the regulations group through which involves the Scottish Government and other key stakeholders, including carers. I did ask permission to share it, so I've not kind of stolen it and run away with it. It is not necessarily going to be the absolute final version. It does need ministerial approval. It will need through the regulations to be laid before Parliament and approved. But it does seem quite likely that the final definition will be something like that. So breaking it down, sufficient breaks means breaks from caring, which enable a carer to have enough rest, leisure and time to A, prevent negative impacts from their caring role on their health and well-being, relationships with others and life balance. B, help them achieve their personal outcomes. And C, help foster and maintain a positive relationship with the cared for person. So there's quite a lot to unpack there. In terms of the rest and leisure, that reflects Article 24 of the Universal Declaration of Human Rights, which is everyone has a right to rest and leisure. So that's important to note. It covers not just maintaining the caring role, that's obviously part of it, preventing negative impacts from the caring role, maintaining relationships. A lot of that is about sustaining the caring role, but it does go beyond that. When you're looking at helping achieve your personal outcomes and having the kind of leisure side in terms of rest and leisure, that probably goes beyond what would currently now be part of the eligibility criteria, what the threshold is. At the minute, it's critical or substantial for most carers when they're looking to receive support, whereas I would argue that in terms of leisure and so on, that goes beyond that. So that's really important to note. Next slide, please. So in terms of routes to support set out in the legislation, there are two routes to support. And they already exist. It's just about expanding them. The first one, as mentioned, and as has been quite clear in terms of the Act itself, is through adult care support plans or young care statements. So that's the personalised support. And that, where a carer has a very intensive caring role, that might be more substantial support in terms of making sure that they have sufficient access to breaks from caring. The other route is what they call in the Act easy access breaks. At the minute, it's most commonly called time to live. And that's the element of short breaks which goes through generally local carer centres. There's at least one care organisation in each local authority area who manages this grant scheme. And that is kind of small grants. It's a bit like almost testers for self-directed support. Normally, typically about £300 or £400, which carers can use to access a break very flexibly. And there's, I suppose, less of a system around it, which makes it very accessible for people. So that will be expanded. At the minute, the Short Breaks Fund receives £13 million a year, and that was 2025-26. With 6.5 million of that being allocated to Time to Live. And as I'll show you later with the financial memorandum, that is set to grow over time. Next slide, please. So what happens before this becomes law? As Donna mentioned, well, first of all, the bill was passed by Parliament on the 10th of June, and then it received royal assent, signed by Prince Charles on the 22nd of July. So this is the phase we're in now. In terms of the development of secondary legislation. You may also have heard the phrases it's sometimes called subordinate legislation, regulations, Scottish statutory instruments, delegated legislation. I think that's just to confuse us, all those different names, but probably you'll most commonly hear it called regulations in this context. It needs to be, they need to be approved by Parliament, and there's different ways that can happen. They may be considered by committee. They may on occasion go through the parliamentary chamber. Most commonly, they are signed by the minister and laid before Parliament. It's a much quicker process, obviously, than the bill, which seemed to take forever. Typically, it takes about 40 days to get through Parliament. So that's the process. Secondary legislation has the same legal status as the bill or the Act. So just to make that clear. And this, as I said, Act is quite unusual in how much detail has been left to this stage. So it feels like, I don't know about anybody else, but it felt like a very long and arduous process, this bill going through Parliament and becoming an Act. And yet so much of it is still to be decided. There's still quite a lot of work around it. Then you've got the development of statutory guidance. Statutory guidance is the detailed instructions to public bodies like local authorities and how they should implement and fulfil their legal obligations. It doesn't have quite the same status as primary or secondary legislation, but it is reflective of it. So it is what they should be doing, basically. The date of enactment we don't have. And we also don't know necessarily in terms of the regulations, which bit of the regulations may be complete in time for the elections, potentially which bits won't be. And this is quite significant because whenever Parliament is suspended for the elections, all bills that are going through Parliament and all regulations fall, they cease. And then it's up to the new government to pick them up. And how they do that is up to them. So it does, I would say, have a bit of a then kind of question mark over it. So in terms of the preparations that are happening at the moment, if it doesn't go through before the elections, then there will need to be a bit of work with any new government in terms of picking it back up and what's going to happen next. Next slide, please. In terms of the regulations relating to short breaks, these were set out in the Act. So this is what's currently in the Act, that the regulations may include the expression, what is meant by the expression sufficient breaks. I think that's highly likely to be in. It may also cover things like the frequency or duration of breaks. It is complicated though, because what's sufficient for one carer might not be sufficient for another. So that was something which is going to need a lot of discussion. You know, it may be the intensity of the caring role is one factor, but also the health and well-being of the carer and their age, their other responsibilities. If they have children, are they in employment? What other supports do they have around them? If they have good friends and family and a good network, and the relationship with the cared for person, and how much they're willing and able to provide as well. So all those things, I mean, it seems simple on paper, but it is quite difficult to work these things out. So all of that needs to be discussed. Next slide, please. A few amendments that came in at stage 3, which I think are significant. Firstly, any definition of sufficient must take account of the carer's need to have time for rest and leisure. As I've mentioned, it's in the draft, which is really good to see. It is in the Act, which means that bit has to stay in. And like I say, it's very important in terms of upholding carers' human rights. In terms of, there's been lots of research around short breaks. Shared Care Scotland did some research on what breaks were used for, which I find really interesting. So 44% of carers are using their breaks to do essential tasks. They're doing them for shopping, they're doing it for housework, medical appointments, and so on. And when asked what they'd like to spend their breaks on, the majority said hobbies and personal interest. So you can see what's happening at the minute. They're being used for essential things, and carers aren't getting to the point where they can use them for things like leisure and even rest. Next slide, please. The other amendment, which is really significant, is it confirms a break may be taken with or without the cared for person. I'll not go through all the details there, but basically it allows for carers to take breaks without the cared for person, with the cared for person where they have additional support, or even where they don't, but it's just a break from the caring routine. And this is something that there's been a lot of inconsistency across Scotland. We know of some areas where carers have been told that they cannot have a break with the person they care for because that's not a break and they can't use a budget for that. That would certainly clarify that. And there's lots of reasons why a carer might want to take a break with the person they care for. I mean, just two would be one, very often if it's somebody with a learning disability, then they may need some support before they can transition to having a break without the cared for person. So it might be testing it out, going to somewhere, for example, a holiday break, seeing how that goes, and then next, having a PA with them, and then, and so on. So sort of transitioning to being able to have a break without the cared for person. Or it can just be parent carers or husband and wives who want to have a holiday together. It's as simple as that. They're family, they want to spend time together, and that's absolutely legitimate. Next slide, please. So developing short break services, without a doubt, I think this is the most challenging part of it. In terms of having enough sufficient range of breaks, we aren't there at the moment. And certainly we've seen things go backwards since the pandemic and more cuts this year. So it is more challenging for carers to access a break, and yet we need to build that up. So if a right to break is coming in, we need to make sure that the marketplace is ready. So that's something I think which needs to happen now. It's not something we can wait until the right comes in. There is a right to breaks implementation steering group which is just being set up, and that will sit, the remit will sit with them in terms of the developing the short break services. There's the interim advisory board, which will play a role in advising ministers. That will also possibly be part of their work. And the financial memorandum does include costings, which I'll move on to in a minute. But just looking at the context of this, we are a long way from all carers being able to access a break. 60% of unpaid carers often or always feel the need for a break. Again, this is Shared Care Scotland's research. Only 7.5% regularly or frequently receive breaks from caring. So there's a massive gap there, unfortunately. 33% of unpaid carers rarely or never get a break of more than 2 hours. And with BME carers, it's even more stark. So that's another area that needs to be looked at. And there are specialists, there are areas like rural and remote carers, island carers, which will need to be looked at. There are, all the different client groups of carers who they're looking after that, we need to make sure there are services available. And we know, of course, we all know there are gaps in every area. I don't know if we always know where all the services are. There's not great scoping around breaks from caring, so we don't even know, I think, have sufficient information on where all the gaps are. Next slide, please. So this is the financial memorandum. First thing I need to say about this is, in the context of the Scottish Parliament, it's not a definite part of the Act itself. So it hasn't been voted through the financial memorandum, if that makes sense. It is something that goes along with every bill as it goes through Parliament. I think a really helpful analogy I read is that it's a bit like an architect estimating for the cost of the building. And when the building is built, it's not part of the building. but it's an essential part of the approval process. And if you've ever watched grand designs, then you'll know that mostly, whenever they cost for a building, it costs far more than they expected. And we strongly believe this is the case for breaks from caring as well. However, set out there, you can see what they have estimated the cost to be. It increases over time. You'll see that we're already out of sync slightly because it starts in 23-24, and well, in terms of certainly the easy access breaks, that increase didn't happen. There was an increase this year in 25-26, but it didn't get up to 20 million. And then you'll see it rise incrementally until it goes up in total to 133 million by 34-35, and that's the upper estimate, 82 million the lower estimate, and that's for breaks through adult care support plans and young care statements. And then the easy access breaks go up to 37 or 34 million. They don't have to stick to these costings. This isn't a definite. Certainly through the Carers Act, what we did see was the full amount, in fact, the upper estimate, which ended up being 88.4 million, was delivered to local authorities. What they then did with it was another question. It didn't all go to implement the Carers Act. However, the money did go from the Scottish Government. So there is a strong indication that there will be extra money for short breaks, which is really important for this. Next slide, please. So this is where I'm going to pause. Where are we at? Yeah, so we're all coming up to past. I've got a little bit later on time scales for adult care support plans and young care statements, but I think we can take a bit of time for either questions or practice points. And the two questions I had thought about, although you don't have to stick to any comments, are welcome. The first is the right to breaks from caring. It enhances rights under the Carers Scotland Act and the SDS Act. How do you see it integrating with your current practice from your current knowledge and the way you work? And what support is needed for implementation, including further resources and training? And that's a really important one, I think, to ask in this particular meeting, because there may be the opportunities to bring some more training into this forum. So I'm going to hand over to Donna now, who I think is going to do the
Absolutely, Claire. Would you like me to? I'll take the screen down so that people just have a quick look at those points for consideration. And as Claire said, we'll welcome other questions too, and we'll just take that. So let me stop sharing, and Laura and myself will look out for hands. And I know we've also had a question in the chat from Pauline, Claire, which was about the composition of who's on the steering group. So maybe if we take that one first, and then if everybody would like to put their hand up or just put some comments or questions in the chat.
I'm not entirely sure if everybody on the steering group, Pauline, is that the kind of advisory group for the breaks for caring, I'm imagining. So it was originally the regulations group, and it's now transforming into the advisory group. So they are going to extend the membership, actually. But certainly the regulations group, which it is at the moment, includes, from the top of my head, carers. We have a member of staff on as the carer representative, so I'm not on the group myself. There's other national care organisations, the Scottish Government, there's COSLA, there's carers, there's health and social care partnerships represented. I'm not too sure who else, to be honest with you, but it will be expanding when it comes to being the full advisory group as well.
It's fantastic. Thank you, Claire. May I bring in Marilyn, please, and then Bex. Thank you.
Thank you. So I work in a children family social work team. Do you know if the right to breaks will apply to parents with children under 18 years old or 16 years old, or is this only referring to people who are over 18 years old?
Yes, because this right applies to carers, it will apply to carers with children as well.
Okay, thank you.
Thanks, Claire. Bex, please come on in. Lovely to see you, Bex.
Hello, Donna. Thank you very much. Yeah, a couple of questions from me. The first one is, if there has been evidence to suggest that the Carers Act implementation money hasn't necessarily been used in the spirit that it was intended, are there other mechanisms being explored for better management of that money, perhaps through organisations such as Inspiring Scotland, who manage grants and issue grants to organisations, or directly to local carers centres? So that's my first question. And my second question, which is perhaps a little bit wider, you mentioned the challenges around supporting carers in rural and remote locations. I largely work in Highland and Argyll and Bute, where we experience challenges on a daily basis around equitable access to support in all of its guises. And I was just wondering what steps are being made to ensure that any models are suitable for rural and remote communities, because the needs are different to our urban settings. Thank you.
Thank you, Bex. That's two very good questions. The first, in terms of how do we make sure the money goes to the right place when it goes to local authorities, is a really good one. It's something that we have raised every year since the Carers Act money came in, knowing that not all of it goes directly to carers. We did an FOI a couple of years ago where we actually kind of looked across Scotland at where the money was going, and we found that some of it wasn't being passed on from local authorities to health and social care partnerships. Some of it was being used for, well, filling holes, basically. Some of it was being used for things which didn't directly support carers, like strategic posts and so on. So a significant amount wasn't really direct support to carers. And we have the same concerns, obviously, around this money as well, which is why it is disappointing that the whole National Care Service, that element, didn't go through, and there doesn't seem to be another kind of way to look at accountability. I mean, I know that's something that the interim board is looking at, but we need that accountability, because otherwise we might have good legislation and the massive implementation gap again. We've kind of suggested various ways. Our organisation was actually working with an MSP to put an amendment in, which would at least mean that they had to report on the spending of that money. And it failed, unfortunately, which was disappointing. I think it's that kind of circular thing of, the Scottish government, it produces this legislation, there's money to go alongside it, they pass it on to local authorities, and then they say that's local accountability, and local authorities say we haven't been given enough money, it's national government. So there is this constant, blaming each other. We kind of think whenever that the money comes through, if there's additional money for short breaks, we need to look at this again. I mean, you make a good point of it going through other routes. That is very much part of the Time to Live or the Easy Access break. So that money goes directly from the government to Shared Care Scotland, who pass it out locally. And it's a really efficient way of doing it. There's very little waste in that. Most of it goes directly to carers. And you can chart it really easily, and we can get figures and how many carers were supported and how much money they received, etc., which we just can't with the other money. So I take your point, and I think it's something that we need to continue to challenge on, all of us, just in terms of that. Your second point around rural and island communities, again, a very good point. Janie Mitchell, who is our Rural and Island Engagement Officer and also a carer herself, is on the group, which is great. We also have a Rural and Island Carer Engagement Group, and she's already done some consultation work with them on what needs to happen to be fed back. We also have a staff group as well. Those are quite small, and more needs to happen. Absolutely more needs to be done. But I think raising it within that group and making sure their eye is on it and making sure that they're looking at it is really important. And if that's something that you can support Bex as well, would be very happy to work with you on it.
Fantastic. Thank you, Claire, and thanks for those questions, Bex. Really important. I'm going to invite Kay in, and then Jane. Thanks very much.
Hi, Claire. One of my concerns, obviously, if there's going to be separate funding for the short breaks element, one of, I guess, our concerns in Ayrshire and probably more nationally is the lack of support actually being put in for the care for people that would actually enable someone to step away from their caring role, because we're seeing a massive shift, as everybody is, in a move to just substantial and critical care only, and there seems to be very little regard at the moment at all for the current standards, social work standards, policy, SDS policy and practice. and we're seeing sweeping cuts across the board. And I think it's great that it's coming in, but I just wonder in practice, is it, how are we going to avoid, as you said, that, the policy versus implementation gap that we're seeing? It's not just we're seeing it in regard to SDS at the moment. We've taken a massive steps back in the implementation of SDS over the last couple of years. And I just worry how this is going to, how we're going to make sure that that we've actually got support in place to allow carers to step back, because we're hearing repeatedly at the moment, well, as a husband or wife, you should be doing that anyway. You shouldn't be having to be paid to do that, or you shouldn't be having, as local authorities are going in and slashing budgets left, right and centre. So hate to be the one that puts the negative spin on it, but I really am concerned about how we can try and make sure it is a success, and people that need the support have the time to step away and take these breaks.
Absolutely, Kay. I totally agree with you. I think we're in a really difficult position. It's almost like the worst time you could introduce a right like this, unfortunately. And it's very hard to take one bit of the system, care support, and expand it and improve it without the whole system being looked at. It's something that came through all the time whenever the Act was discussed. The fact and the Feely report as well, we need to look at the whole thing. So, without having improved workforce, without having more people working within social care, without expanding, the services that people use. And when we say short break services, it can be things like building-based services, which are used to enable carers to then have a break. All of these things are absolutely critical. And I wish I had an answer. I'm sure you won't be surprised to hear that I don't have the answer. But I feel like we're very clear in the Coalition of Carers that we still need to push for a rights-based agenda, and we need to embed everything within human rights as well. And although it feels like sometimes you're pushing whenever everything around isn't supporting it, you still kind of have to do that. But I think there's a lot of work that needs to be done both before the break comes in, but I think it's going to take much longer as well. You'll see the way with the financial memorandum, it increased every year, it was incremental. And I know that the previous minister, Mary Todd, often talked about it being progressive realisation, which basically means it's not going to happen all at once. It's going to happen incrementally. I think it feels a bit like a massive, tanker that we're having to turn around at the moment. But I think we need to start doing that. And I think one of the key things is, yes, absolutely. In terms of replacement care, that's such a key element to carers being able to take a break, and all that needs to happen alongside as well. So I'm sorry, I don't have any absolute solutions, but I do think we still need to look at this agenda, because unfortunately what's happening is, as services have been cut, more and more of that pressure lands on carers, and we're absolutely seeing the result of that. And I think we need to look at the carers in terms of in the way we do with the workforce, that one, they need protecting in terms of their own safety, health and well-being, but they also need supporting because they're not a finite resource. And we need to make sure that the caring role is sustained, but also it doesn't have such a detrimental impact on them as well.
Thanks for the question, Kay, and thanks, Claire. I'm going to ask Jane to come in, and then Alistair. Thank you.
Thanks very much, Donna, and thank you very much, Claire, for your really interesting presentation. And I think the points that you made around the financial memorandum, really good way of thinking about it. So it was just to point out that back when this was part of the National Care Service bill, Social Work Scotland put in a response around the financial memorandum. And I've popped that in the chat if you want to have a look at that. It's on our website. And also the kind of key issues that Social Work Scotland identified with regards to the kind of funding of this. And I think, we've kind of heard from our finance side within Social Work Scotland that they reckon it's significantly underdone, the financial memorandum. So it's just to sort of put that in there, that continues to be an issue. It's not the only thing that obviously that is the implementation concerns itself with, but if we don't have sufficient funding to provide the breaks from care, then that's a real issue. So it's just to sort of point that out and to give you the opportunity to have a look, if you want, at that financial memorandum response from Social Work Scotland. Thank you.
Yeah, thanks, Jane. That's really important. I think that was Mike Brown. We were involved a bit with that work as well. He's absolutely right. You know, in terms of, firstly, that financial memorandum goes back to 2002. So we already know that there's more carers in the system. We've had the census since then. In terms of looking at the categories, you know, of the amount of hours caring, which they've built on as well, we know that's changed with the census as well. The number of carers caring more hours has increased. And, you know, amongst other things as well. But I think in particular, they also looked at, you know, the money that was being spent already and used that as part of their calculation. So they included all the money within the Carers Act funding that was supposed to go to short breaks, which we know hasn't. So there's all sorts of factors, other ones as well in the report, but we know that there is significant underestimation.
Thanks for that, Jane. And as Jane said, the link to our responses is in the chat for you. I'm also aware there's lots of amazing questions in the chat, which we'll come back to at the end. And if not, we'll be able to pick them up with Claire after. So please don't be worried about that. But we'll take the next three and then we'll let Claire finish her presentation, and there'll still be time at the end. So Alistair, would you like to go first? Then Margaret Jane, then Philomena. That's great. Thank you.
Thanks, then. Yeah, I mean, there's been some comments about accountability and sort of transparency, and I think just following up on that, I guess my point is about the connectedness, you know, because it feels like we're going backwards on so many things. It feels like Jenga at the moment. We're introducing new positive things, but we're also eroding so many things at the same time, and that danger that one bit becomes an underpinning other part, it gets abused, it gets sidetracked to fill another gap. I'm just wondering, especially given the timeline and the fact that it's not going to potentially get fully implemented until next government, is there anything else that you think we can do to try and avoid that? You know what I mean, that trap, because it just feels such an obvious one that, you know, we celebrate a victory over here. Meanwhile, you know, we're taking 3 steps back over there. And particularly with the local implementation. So, you know, nationally, it might be said that this is the focus and this is what you have to spend it on. But I'm aware of historically like judgmental comments about what folk can spend things on and people feeling guilted into, well, not that. So I'm just wondering about that sort of connectedness. Is there anything that you think we can do?
To be honest with you, Alistair, I think continuing what we're doing, I think we're all in different forums and having different conversations and trying our absolute best to make sure that these cuts don't happen, or mitigating the impacts of some of the cuts that are being made. And unfortunately, we know some of the savings that health and social care partnerships are having to make even at the moment, which is really concerning. So I think just all of us, as far as we can, being advocates in whatever organisation we're in, working across whether it is locally across health and social care partnerships, or whether, you know, ourselves as a national organisation working nationally, to kind of, I mean, it's a bit like Philly talked about changing the conversation around social care. It feels like that hasn't happened yet. The value of social care and that understanding that, I mean, there are so many different aspects to that. There is people being economically active, which is really important. Caring roles not breaking down, which costs the system far more later on. You know, it's about valuing everybody in society, and looking at in terms of the impacts on health when you don't have good social care. So we know all this. Everybody in this call is signed up for that and understands it. And I know that in all your own kind of groups, you are probably advocating to the best of your ability, and we're doing the same. There's no magic wand, unfortunately. I just think we need an absolute sea change. You know, we need to really understand what is happening. And I always think the worst thing is when you lose something, it's 10 times harder to start it back up again. And this is why it's so difficult whenever services, you know, no longer exist. So I guess we all just go forward and we do our best in terms of advocating for this stuff.
Thanks.
Fantastic, Alistair. Thank you for that question. And actually, yeah, we're all part of that sea of change, Claire, absolutely. So let's have 2 more questions and then Claire can finish her presentation and then we can grab some more time at the end. So Margaret Jane, please, and then Philomena. Thank you.
Thank you, Donna, and thank you, Claire. That's just an exceptionally helpful presentation. I totally recognise a lot of the conversation. Certainly in my HSCP, we do use Carers Act money for staff, very limited amounts of staff, but to be honest, I think it's naive to think that we can deliver on such a big agenda without resources there to do the heavy lifting. I think this presents a real opportunity for us to be more creative and think about SDS in its truest sense, and you know, how we really think about choice and control and more creative solutions for short breaks. But the funding model does concern me. I mean, we've all seen I'm sure we've all seen the Audit Scotland report round about the financial sustainability of integrated authorities. I think it says something like we've got a 1.1 billion shortfall across Scotland. It's significant numbers, and it would be naive to think that any aspect of our services would be completely protected from that. So how we balance the broadening of the eligibility criteria with funds which are already hugely under pressure, I haven't quite got my head round about that yet. My question is round about that accountability, Claire, and if there's any sense that I'm assuming the budget will come to local authorities to be passed on to HSCPs, but if there's any sense of what the new reform National Care Board will expect in terms of reporting and data round about this specific thematic.
Really good points, Margaret. Thanks for those. I'll just maybe pick some of them off. But yes, you're absolutely right. Apologies if I was suggesting that there shouldn't be staff employed to undertake the implementation of the Carers Act. Absolutely they should. In some areas it was quite far removed though, so it was posts that were really quite strategic rather than or not really directly involving carers was the point I was making. Yes, creative solutions, absolutely, we need them more than ever, both because they really work for carers in many cases and also because there often isn't the staff. And so I think the Time to Live Fund has been really good in that respect because it has allowed a bit more freedom and a bit more kind of trying things out for people. So sometimes it might be things like buying a bike, or a gym membership rather than necessarily having 2 hours off from your caring role, and that can be really supportive for people. There's lots on the Shared Care Scotland website. There's loads of examples if you want to go on. They've got really good reporting around it. And finally, on the accountability, my understanding is, and again, I don't know, I'm not part of the Scottish Government, but my understanding is it will go again to local authorities. In terms of accountability, they should be reporting already in terms of care spend from their annual performance reports, but they don't. So I think maybe sometimes it's about picking up on areas which are already kind of in policy, which maybe aren't following through, or maybe looking at additional ways to be accountable, which we'd like to see. We've always said that we want to see carers as a budget line. It's impossible to track, and I know the difficulties because carer spend can be in lots of different areas, and pulling it together might be complicated. But at the same time, it's very difficult to scope, make plans, and do costings, for example, when we don't have that information.
That's great. Thank you for that question, Margaret Jane, really helpful. And finally, Philomena, and then as I said, we'll go back to Claire to finish her presentation. And I think we've got an opportunity to grab all the questions in the chat and our questions that were posed at the SDS National Collaboration last week around this, and maybe together come up with some kind of bulletin or response, Claire, that local people can use when they're having their discussions with elected members or with leaders or in communities. So Philomena, last question for this session. Thank you.
Hi there, thank you. I work within Children with Disabilities team. So there's going to be a significant change for us if previous exclusions are repealed and parents of dependent children now come under the Act. And I just was looking for a bit of clarity around that and whether there'd been any thinking about where the parameters are with that, because obviously there were previous exclusions. And also, I think just to share with everybody else the kind of frustration around looking to implement this well within a landscape where social care is in such crisis. And I think for children, trying to find resources for children and is particularly difficult as well, because their supports, of course, are around school and around that support. So our support packages tend on the whole to be smaller, and it's very, very difficult to find resources and companies and you know, recruit PAs for that level of need. So it was just really to highlight that there are other kind of specific issues around parent carers and young people, and in my case with additional needs, but it was really to look at where would the parameters then be around parent carers.
Thanks, Philomena. So this part of the Care Reform Act actually amends the Carers Act, and that's where the legislation is changing. So the rights build on the rights already within the Carers Act. So it's looking at it from the carer's perspective rather than the child's perspective, if that makes sense. So that means it's carers of any age who can be supported through this amendment, or this change to the Carers Act. So it goes through the adult care support plan, as I said before, or it would be the sort of easy access breaks at the route to support. And obviously parent carers can also receive an adult care support plan. I take your point that some of the services that they may need to support them may be something to support the child instead, if that makes sense. That's where the difficulty comes, because the idea of, you know, the carers having a break is where it then needs the replacement care and the service for the child, it does become a little bit more difficult, and that's been raised by other people as well. So they are considering replacement care within the advisory group as well, and in the Carers Act, in the statutory guidance, it goes into quite a bit of detail around replacement care as well, so you can have a read of that too. It gives a bit more detail there. But it's always that tension, isn't it? Around, and in fact, it was one of the amendments that came in at stage 3 in terms of the involvement of the cared for person when a carer takes a break, how that is worked out. It's slightly different when it's a child, but I think it's an important point to make that there sometimes is a tension when a carer wants a break and the cared for person doesn't want the service that enables them to take a break. And there's also a tension whenever you can't get the service for the cared for person in order for the carer to get a break, and it's so enmeshed. I mean, it's a bit, when we look at these things separately, which we do tend to do in legislation, it's a bit of a false divide because their lives are so enmeshed, and you can't really look at them. Never more so when we looked at, you know, no charging for carers. You know, was it a service for the carer? Was it a service for the cared for person? Could you charge? All of that came out then as well. And I suspect a lot of these conversations will have to be had when the regulations are being looked at as well.
Absolutely. Thank you, Philomena, and thank you, Claire. Claire, are you happy for me to put your presentation up for the last few slides?
Yes, just a couple of slides, Donna.
Perfect.
You'll be glad
I'll
to hear.
do that. That's lovely. Yep, I think there's just 3 there. So let me just pull that back up again. I think we're at number 13, so I will do my best to get to the right one. Let's go on to, there we are, points for consideration. There you go. Okay, Claire, thank you.
Thank you. So one of the amendments that came through the bill was timescales for adult care support plans and young care statements. Scottish ministers must, by regulation, prescribe timescales for the preparation of adult care support plans and young care statements. At the minute, the way the Carers Act sits is there are timescales for people looking after somebody with a terminal illness. This is now extended to all carers. The reason behind that was that you know, from a carer's perspective, it was causing hold-ups for them, basically. So some carers have been waiting up to 2 years for an adult care support plan in some areas, unfortunately. In some areas, there weren't really pathways for young carer statements, for example. Well, one area I can think of. Some carers would ask for an adult care support plan and never hear back. And if it's attached to a right to breaks from caring, then obviously that means that it's another way to have effectively eligibility criteria or to prevent people from able to access their rights. So the decision was made to put in timescales for adult care support plans and young care statements, with the idea of applying the right to breaks more consistently. There are concerns, obviously, about implementation and capacity around this. If you go on to the next slide, thanks, Donna. There's also, it's quite complicated in terms of the different stages. It's kind of not really one time scale, if that makes sense. The first thing I'm going to say to reassure you is it won't be 10 working days. It's something which they are going to do some consultation around. It's likely to be much longer than that. I can't tell you the exact time, but I would imagine it'll be well, at least 6 weeks, something like that. But again, consultation around that. So don't take that as read, but it won't be 10 days. But I wanted to show you this slide to show you the different stages and how the regulations work in terms of looking after somebody with a terminal illness and then receiving an adult care support plan or a young care statement. So first of all, it's looked at in terms of how long, well, the day that the care is identified. So either they approach their local authority saying they're a carer, or the local authority identifies them as a carer. From that point, they must offer an adult care support plan or young statement within 2 working days. In terms of the first conversation, that needs to happen within 5 working days, and the adult care support plan or young care statement needs to be prepared within 10 working days. So a few caveats in there. First of all, the carer themselves may say, well, I don't want it in 2 days' time, I don't want it in 5 days' time or 10 days' time, I want a longer process, which is fine. There may be unforeseen circumstances from the point of view of the local authority, but you'll see it's almost like that kind of 3-stage process of being offered one, having one, and then having it prepared. So those 3 stages will probably remain the same, but the time scales will differ and will be longer. So that, like I say, regulations are being worked on. I'm not too sure whether they'll come in before the election. But like I say, keep an eye open. I'm certain we can send information through Donna in terms of any consultation around that. And just a few questions or thoughts around that. I'd be really interested to hear your points of view, actually, as well as questions. So is your pathway for carers in your local area clear at the moment? In terms of adult care support plans or young care statements, particularly when it involves more than one partner, because quite often what happens is a carer centre will undertake the adult care support plan, but will then pass it on where they believe the carer has an eligible need, or sometimes they're all passed on as well. And what are your current timescales, do you think, in your area? What are the resource implications? So I don't have answers for these. These are just things to think about and to raise in your local area, almost from the point of view of saying this will come in at some point and we need to start thinking about it now. We need to be clear about our pathway. We need to be clear about our timescales and how off we are in terms of, you know, what might come in and what are the implications. That's me.
Fantastic, Claire. We've got 3 minutes left. We've got a raft of questions in the chat, and so we are very happy to work alongside Claire as we do, and our members of the National Collaboration to kind of look at some kind of response where we can, just to keep that conversation going, to keep that evidence coming, and to kind of give us all an opportunity to be able to, get involved in anything that's about evidence gathering or suggesting, what good practice might look like. So, Claire, a massive thank you for coming along with such an amazing presentation and really thoughtful, and just giving us the facts as well, and also giving us lots of things to think about, whether we're in local authorities or carer centres, carers ourselves, or part of supporting carers to have breaks. So thank you very much for that. Is there anybody that would like to make any comment regarding Claire's last couple of questions, or any general observations before we finish off? Anne-Marie, please come in. Thank you.
Thanks very much, Claire. That was absolutely brilliant. I feel like I've got a much better understanding now, so thank you. I suppose my comments about frailty, as we have more and more older people living longer,
frailty is a big issue for us, or for all of us. It's not a terminal illness, but very frail, very old people require tremendous amounts of support and are often fully dependent on their carers. So I'm just thinking, where does that fit? Because it won't fit with the terminal illness, and yet their life may be very limited. Their lifespan may be further limited because of their frailty. So I just kind of wondered what had happened in some of the discussions around that.
Thanks, Anne-Marie. I think that's a really good point. I don't think there has been a lot of discussions around that, I'll be honest with you. In terms of, you mean in terms of the timescales or just in general, the right to break? Are you meaning, sorry, in terms of the timescales or just the right to break in general?
Sorry, I'm meaning I thought you'd frozen on the screen there, Claire. I meant in terms of the time frame, you know, if you're going to have to put support in quickly. So somebody who's very frail can go from being very frail to even more frail in the last days of their life or weeks of their life. So it's around that time frame.
Yeah, so we have actually done a what to expect leaflet with Marie Curie on this in terms of the regulations for people with a terminal illness. It's on our website, and we can maybe make sure it goes out, you know, with the notes of the meeting. And basically, it's if the person is anticipated to have 6 months or less to live, and that's where it's always difficult, where it's maybe a progressive condition or frailty, and you know the person has been diagnosed and it's maybe been quite a long time since diagnosis, and what time do you say, well, you now fit those regulations? So that is something that can be considered, you know, in terms of if they think a carer is in that situation, then the regulations would apply to them. Or alternatively, when the new timescales come in for all carers, they would obviously be covered under that as well.
Thanks, Anne. Thanks, Anne-Marie, and thank you, Claire. Janie, would you like to have the final comment? I'm aware that we're just at 11 and we want to keep you too long, but Janie, please, would you like to have the last word? You're very welcome. Thank you.
I don't really want the last word.
So come on, Janie, you can.
I sit on the group that Claire's been talking about, and I suppose I just wanted to sort of reach out and say, you drop me an email. I'm kind of trying to make as robust a list of what a creative break is, or what a break means to people, to include ironing, all the stuff that we've done years gone by around self-directed support. I think it's also important to note that whilst we will put in timescales, we have no powers to hold anyone to account to make around timescales for when the support will be put in place. So there will be timescales around the adult carer support plan being completed or the young carer statement, but it could then take a year for the support to, and we've got no power over that. So I think that bit's very frustrating for us. So we need our partners to also step up. Yeah. So I want Claire to have the last word, not me. But if folk want to reach out to me, particularly around the rural and island stuff, I've been trying to answer questions because that's obviously my bag. Okay.
Brilliant. Thank you, Janie. Claire, last word, and just a huge thank you from everyone to you, Claire, and also thank you from the team, the SDS team, to everyone giving up their hour today. We hope that's been really useful, and as I said, start of the conversation about something which we hope will ultimately support carers. Over to you, Claire. Thank you.
Well, first of all, thank you so much for inviting me. As you just said, Dawn, I think this is really important that we're talking about it. I think we're going to have to talk about it for the next year at least, if not longer, because we need to make sure that preparation is in place. And I strongly suspect that the Minister is right, and we're talking about progressive realisation. We're talking about it not all happening at once, but we need to be pointing in the right direction. And I think the best way to do that is for all of us here to sort of play our role, no matter how big or small, and be advocates for this as well, not just for the care support element, but for everything that goes around it, which needs to be there to make it happen. And you know, thanks for coming in with that, Janie. Absolutely. Please get in touch with Janie. I'm really glad that you mentioned that as well.
That's lovely. Thanks again, Claire. Thank you to everyone involved, and have a lovely rest of the last day. And as I said, we will be in contact soon. Thank you.
Thank you.
Thank you.
Thank you.